I was surprised in the best possible way to see some things on there that I wouldn't have thought from a patient perspective was there. There was so much focus on education. How do we really change how we educate people, not only about the disease, but treatment options? And that was in a place that was talking about education at the PCP level, right? So your primary care provider, that's where these conversations can start with an endocrinologist, with family medicine, right?
With medical students.
With medical students. We talked about that. And I thought I saw, and I really had to zoom in on these pictures because the infographics were amazing.
They were huge. Yeah.
They were huge. But it talked about how do we really use patient forward or patient friendly language? How do we invite people into this conversation without immediately, triggering their defenses? But how do we approach this from a compassionate angle of like, look, I understand this is not your fault. You didn't ask for this. But as your doctor, it's my job to help you live your healthiest life. And your excess body weight is something that concerns me for all of these health reasons. I can see you have a robust life. You have children, you're active, you're this, you're that. I'm not talking about that. You're rocking and rolling in that area. But this weight is going to, or maybe is impacting your life in a way that I don't yet know, but I can make some assumptions just based on how I see you showing up in the world.
Our president-elect, Rich Peterson, my friend, made the point that when he was in medical school, and it's true for all of us, we got almost no education about obesity. And that's something that he would really like to see change. And even our colleagues in internal medicine and family practice and whatnot, a lot of them are very far behind in being up to date on current treatments for obesity. And it's not their fault. It's just that there's so much that they need to know about other things that they don't necessarily know what's out there and what's available for treatment.